So I wanted to be a home economics teacher, purely because I loved my teacher. She was so inspirational, and she was kind of like my driving force to get through school. I didn't have the best time at school, but she was always, I'd see her in the corridor and she'd ask me, how's your day, blah blah blah, and she just really made me feel like at home at school. And I loved the subject. And when you get to sort of fifth year, it was a higher, and it is classed as science. So, my dad used to sort of say, you get an A for two slices of bread and a B for one slice and all that nonsense. But it is actually a science, and that's what I wanted to do, is become a teacher when I left. I went to uni to do food, nutrition and health. That was a BSc honours at Abertay University in Dundee. So it's a 4-year course, and it was basically just about food the whole way through. The first couple of years you have to do a bit of cooking, and then the rest of it was quite sciencey. But after that, I didn't really know where I wanted to go. I'd changed my mind. I didn't want to be a home economics teacher anymore. And so I did a master's at Glasgow University in human nutrition with a specialisation of public health. So after that, I did a job with Lanarkshire Community Food and Health as a public health nutritionist. And that kind of got me the experience that I needed. And I also worked with health improvement through that job. And I kind of got a taste for what they were doing. And then a job came up and I applied for it and I got it. The job that I was in before this one, it wasn't challenging enough. It was a really good starting point to get experience with lots of different community groups, and like working out what you like to do and what your sort of niche subject is. But there was always going to be a time that I moved on, and I feel like health improvement was a good next step. Yeah. So my job, so I'm the health improvement practitioner for Wishot and Shot. So when you come into health improvement, you get given a locality. So in North Lanarkshire, there's quite a few, but mine is Wishot and Shot. So I'm responsible for being a topic champion for early years and for nutrition. So for early years, I'm responsible for the Healthy Start vitamins, so making sure the nurseries have a supply, making sure they know where to get them from. I'm also responsible for the Breastfeeding Friendly Scotland Act. So that's working with another member of Health Improvement to make sure that all the premises in North Lanarkshire are signed up to the scheme. And if they're signed up to the old scheme, we're currently transferring them to the new one. And that's just about making the premises, breastfeeding friendly, really, but it's making the mums aware that they're free to breastfeed, and there'll be no issues. And if there is, then they get directed to the Act. So other early years stuff is weaning. So I haven't really done much of that at the moment because of the situation, but if you were to come into health improvement into early years, that would be one of your sort of areas of responsibility. For nutrition, there's not a whole ton at the moment. I sit on one of the working groups with Susan Short, who's the lead for maternal and infant nutrition. And it's about, I can't remember what it's called, it's like the Healthy Weight Strategy and Food Choice Group. So it's about the sort of canteens, the stuff in the hospitals, making sure people have access to healthy food. And because I'm early years, I have a remit for making sure children have the access to healthier choices. So in the nurseries and schools, when they come to classes and stuff that are run by the community, that the food that they have access to is healthier. And then nutrition, apart from that, there isn't really much. I guess it's just tying into oral health as well for me. That's one of my other responsibilities, is sitting on the champion group for that. So making sure that folk have access to toothbrushes, toothpaste, we give out free stuff, and also promote the key messages through like National Smile Month and stuff like that. and linking in with the nurseries for events like those too. So I have a really good team, although there's a vacancy at the moment, we're still quite, I'd say, close knit. I came into the job during in fact, the first day of lockdown, and they all made me feel so welcome, even though I didn't meet them for a while. It was kind of over the screen that I had to meet everybody. But I feel like that has had its benefits, that we've gotten to know people maybe faster than we would in person, having this sort of direct one-to-one contact. So yeah, it's a really good team. My manager Mark is so flexible. He's possibly the best. In fact, he is the best manager that I've had in my life of jobs. He's just so supportive. He's always on board with what I want to do. He's keen for other ideas. There's never a wrong question or a wrong answer for Mark. It's all chill. So that's really good. I also like the fact that I'm on the ground with the community. So a lot of higher up jobs don't have as much work on the ground with the communities and making sure they're listening and finding out what the communities need or what they want. So there's a lot of working with different partnerships and different groups in your specific locality, which is really nice. And through those groups, you get to know the community a bit more rather than just sitting in an office all day. So I really like that, even though I've not managed to do an awful lot of that because of the situation, but I'm starting to get out a little bit more. So yeah, I really enjoy the community aspect. Also, I guess the fact that it's so varied, no day is the same, they're all different, and you get to do a lot of different things. And there's lots of opportunities as well for training. If you're interested in things like book bug, you can do book bug training, you can do alcohol brief intervention training, which means you can deliver an ABI with an individual who's maybe struggling with alcohol, or you can deliver that training to staff so that they can roll it out to other organisations. So yeah, there's just loads of opportunities. Everyone's really friendly, and the community side of things I really enjoy. I think it makes your job seem worthwhile. Even if you're sitting at home behind the screen, you still know you're possibly making a difference, even if it's just one person. You're still helping everyone. So quite a lot of the time we do like needs assessments. So we meet up with an organisation and we ask them, what are the community saying to you that they want, or what do they need, what's missing, what are the gaps. So in my locality at the moment, one of the things is like youth disorder. So we're trying to come up with things to target the individuals that are causing havoc basically in the community. So previously I did a project that was called Urban Arts, and it was getting a group of boys from a high school, excuse me, and they participated in graffiti workshops. And then after I think it was 5 or 6 weeks, after those weeks, they then displayed their artwork at an event. So that's just one example of stuff, of a project that you can do. It's not directly related to health, but it is a little bit, because it's kind of about mental health and confidence and self-esteem and all that. So it's not like, it isn't just strictly health, it's other stuff. As long as it kind of has a little bit of a link, then it's usually suitable to do. So I think just making the communities know who we are as well. So we're not, I do wear the NHS lanyard, but it's not like, I'm NHS and I'm sitting all high up. It's actually I'm a person as well. And even though I don't live in North Lanarkshire, I think it's been an eye opener actually, because it's so different from where I live. I don't really know North Lanarkshire too well, but getting to know the community through the partner organisations has been quite cool. And I guess also the community boards as well, we sit on those, and that members of the community can sit on those as well as like partners. So they take place in the evening, and they are quite long meetings, but good stuff usually comes out of them. So that's another way of community engagement, and also social media as well. We put loads of stuff on social media. We try and advertise activities that are ongoing, and quite often they're free, which is really good. So yeah, social media as well.